helping make your life easier. Moms Every Day.
Hey everybody, it's Hattie Teak with Moms Every Day. We have Dr. Scott Gibbs with us today from Cabell Huntington Hospital. He's an otolaryngologist. So today we're going to talk about what you specialize in, which is voice disorders.
Correct.
Not something that we always think about. You have people who lose their voice a lot.
Yes, yeah, I sure do.
People can chronically lose their voice.
That is absolutely true. Now, some people it'll be a short-term problem, a few days, or sometimes it's more chronic, particularly people who are teachers, broadcasters, ministers, lawyers, people who have to use their voice a lot. And so sometimes they'll start having problems with their voice being raspy, hoarse. They just can't speak for as long as they would like to. Right.
So they notice that the length of how long they're able to speak has now been shortened. They're starting to get, kind of talking like this a little more.
Exactly. And so that's called vocal fatigue.
Okay.
And so that's something that I'll see, and part of the voice evaluation is what's causing that. And generally I kind of recommend people, if you've had a voice problem for longer than a few weeks, you might need to
a few weeks.
Correct.
A few weeks. So your voice is not there for 2 weeks.
Well, you can have that raspiness and that hoarseness where you're not talking normally. Now, if you have a period of where you have some what we call aphonia, where you have no voice at all, obviously that's a little more concerning. I mean, if you get a bad viral illness, and probably that's one of the most common things I see, is you get sick, you get a cold, and your voice is gone. Usually that is going to get better. Usually give it some time, 2-3 weeks, drink lots of fluids, some chicken soup, that actually does help.
Yeah.
And
broth is good for the
broth
throat?
Is good.
Okay.
And if it doesn't get better, normally that's going to resolve within a week or so. If your voice is still pretty bad and it's been a couple weeks, then you probably need to see someone like myself.
Right, so they'll come and see you, but when they see you, I mean, is it like, okay, I know I'm going to be able to figure out easily what's going on here, or could it be an even bigger problem that leads you down the road?
Time you see me, I'm going to talk to you. I'm going to find out what's been going on, how long. Oftentimes when I see people, they've already had some treatments done. They may have had some antibiotics or some steroids.
Yeah. Thinking that it was something different.
Correct.
Okay.
So then I'm going to see you, examine you real well. Now, the exam in the office is usually you want to get a good look at the ear, nose, throat, voice box. So you're going to do a fiber optic. It's called a fiber optic laryngoscopy. Sometimes it's called a video stroboscopy, where you're looking at the vocal cords, how they're moving, and their function. And that right there tells you an awful lot. If there's a growth on the vocal cord, then that's going to take you down one road. If it's something that can be treated medically, for instance, some people may have severe reflux into the throat. You can treat that medically with your diet. So that exam really helps figure out which way you need to go.
So even heartburn can contribute to your voice problems, really, because I mean it's all right in the same area.
That's right.
And I don't know how closely you follow Adele or any other musician, but basically some issues that she's had and other musicians, they've had to see somebody like you.
Exactly, and that's oftentimes they use their voices a lot, very demanding. So you may have a vocal fold hemorrhage, a vocal fold nodule, a vocal fold cyst that may need to be managed medically, may need to be managed surgically. And obviously someone who sings for their career,
especially like Adele.
Exactly, that voice is incredible.
Right, the powerfulness. Now, a specific voice disorder, I don't know if I'm going to pronounce this correctly, so bear with me. Spasmodic dysphonia?
Yes, spasmodic dysphonia. That's very good. No, that's very good. That is a type of what's called laryngeal dystonia. So that's a specific type of dysfunction of the voice that's there all the time.
Okay.
And it can develop in young people, it can develop in older patients. Sometimes there's a family history. That is where you'll have difficulty saying certain sounds. So the most common type I see is called adductor spasmodic dysphonia. And so when they count, say, from 80 to 90, it'll be 80, 81, 82, 83.
So they have trouble saying different, sounds?
Sounds.
Interesting.
It's where they're closing their vocal cords too forcefully for too long.
Is that something that's developed over time, or typically people, it sounds like it would...
It can develop very quickly.
Yeah.
Sometimes they wake up one morning and that's how their voice is. Now, that will oftentimes be a little confused with what's called vocal tremor. And vocal tremor, if you remember Katharine Hepburn's voice, she had the vocal tremor.
Very interesting. All right. So, and also, if you want to learn more about this, you're going to be back with us at 4 o'clock today. We'll be talking more about voice disorders and things like that. So if you need any more info, head to our website, WSAZ.com. Click on the Moms Everyday tab. You can rewatch the interview. Thanks for joining us. Stick with us.